are also allocating resources in order to augment the resources that we are getting from CHAC and from other organizations, including contributions from other development partners, in order to enhance family planning in this county. I know wakati mwingine when we talk about family planning, it becomes a completely controversial issue. Even some of the religious organizations do not want to believe in it. But we want to say that if we are going to talk about universal health care for all our people, we have to look at all the facets, including family planning, and including the work that you are also supporting us towards addressing the issues of HIV and HIV/AIDS. We are very, very keen to see a wholesome family. And a wholesome family is one that is properly planned, properly spaced, and well endowed so that they can access some of the health outcomes that we have been working on in this county. So family planning is one of those important components of making a family iwe ni familia ambayo imejisimamia, na hiyo ni familia ambayo hata inaweza kwenda na kupeleka watoto kwa shule, waende kwa university na wapate kuwa na kazi. The population of Kenya at one point in the 70s going to the 80s was growing at more than 2.8%. We are almost 4%, the highest in the world. And because of people coming together and thinking about aspects of family planning, we were able to reduce the population growth rate to about 2.5%. And that is what it is here in Kiambu, just about that. Of course, Kiambu population is increasing not because of getting more children. The population of Kiambu is growing at a very high rate because of people coming from outside Kiambu and coming to settle in Kiambu, which we welcome. What it does is that it requires us to extend all the necessary services inatufanya tuwe tunafikiria beyond sometimes our resources on issues such as environmental management, garbage collection, because the more people are living, and we are one of those counties with the highest population living in urban centers. About 64% now of our population lives in urban centers, which means we have to be able to enhance our capacity to manage garbage. Because the more urban you are, the more the more garbage management systems are required from you. The same with water. We increasingly have higher demand for water than we can be able to supply. And even for other infrastructure such as sewer. So we know that we need to plan, and like Dr. Mulega has said, we keep on saying if you don't plan, you plan to fail. Unfortunately, like I said, this country has politicized family planning. Ni vibaya sana kwa sababu kama nchi tunafikiria kuwa we are told by 2030 we shall be 66 million Kenyans. But that will be requiring a lot of resources, as I said, and a lot of services. What we need to do is to plan so that we have facilities that will cater for the population at that point. But we know that politicians have been telling their people that they don't have to plan their families so that they can have more voters, so that one region can have the margins higher than the other. And I think I really need to urge our politicians and our leaders to be practical because what we are telling our people is really not what there is. Because we now have even aspects of climate change, even places where people are being encouraged to increase in numbers are those areas that are marginal. And when it comes to the drought like the one that we have right now, they are more marginally or more affected. So I would urge our people not to politicize family planning. We will continue to support it. It is one of the health outcomes that we in Kiambu have been working on.
Clergymen, other religious leaders to come on board and agree that God is a planner and is inviting us to plan our families. The Bible tells us in 1 Timothy 5:8 for an unbeliever not to take care of her family, he is worse than an unbeliever. So as a clergy people, we should call our families, even our churches members, to plan their families. When they plan their family, they'll have a better home, a better church, a better community, because they are basic needs that we need today. We need proper education, we need proper health, we need shelter, clothing, and many things. And we have to subdue our family. We should take control of our families and make sure that what we produce, we are able to produce and even to bring care in the proper way that you desire to have. So we are all called to bring up productive families with good quality and good health.
My name is Dr. Samuel Mwenda. I am the General Secretary of Christian Health Association of Kenya, which is a national faith-based organization of the Protestant churches, health facilities, and medical training colleges in the country. You're able to have your pregnancy or your child the time when your body is ready. You don't have other issues. You are psychologically very settled. You're able to carry the pregnancy up to to term, to the 9 months, and have a good delivery, have a good baby. Babies require period of time with their mothers for breastfeeding, for nutrition, for being helped until they grow. So the spacing of the children, once, helps the health of the mother. Number two, it helps the health of that child. Now, when I have the right number of children, then it means I can take care of all my children well, in terms of feeding them, in terms of any help they need, but also the education and other support they require from a parent. So there's benefit there at that individual level, but also when you go to the bigger community, we are able to, the resources that we have are able to be enough to meet the needs of the people that we have. It's the same thing at country level and even as you grow. So it's not about preventing people to have children, it's about helping them to have the children when it's most appropriate for them and help them with the number they need. Because if we are not able to have the information on how we can do it and the methods that we can use, maybe to help us prevent not to have pregnancies when we are not ready, then you end up having them and it becomes stressful. It may affect your physical health, may affect your mental health, they may also affect the health of the child that is being born.